Hello, everyone. You can see, with the protocol and everything, I'm supposed to wear a mask and wear a mask now for up to 10 days from when all this started. What we've got set up in my office, and there's no one in my office at all. And so I'm going to take my mask off and do the briefing, but I thank you so much for letting me be with you today. And it's been I got to admit, it's been a little bit difficult, that's for sure. But by the blessings of God above, and I've got my Bibles right here beside me at my desk, and all your well wishes, I'm beyond humbled, and thanks seems almost so inadequate, because really at the end of the day, it'll never be forgotten by me, all the people that reached out, and all the well wishes and all the prayers. And I've got to go back and just tell you very quickly, because so many people probably are wondering, well, what happened? And it was really bizarre, to tell you the truth. I was writing the State of the State address, and really looking forward to doing that in every way. It was probably, I don't know, somewhere around noontime or they're close, and all of a sudden, I'd gotten up kind of feeling, like a little scratchiness in my throat, maybe a little bit of congestion, but then all of a sudden I started to get, feel like I had a headache, and then from that, you were chilling a little bit, and I thought, well, am I running a fever? And so at that point in time, I immediately called to get tested, and so, as we were waiting, we got, the rapid test and the other tests that we send off, and while we were waiting on the results of the rapid test, I was just thinking, for crying out loud, this feels different. I've been tested about 20 times, and this feels really different. And so all of a sudden, the rapid test came back negative, and I thought, we're good. Because really and truly, I wanted so badly to give the State of the State, because we had so much good news to report, and it would really have been, the most enjoyable State of the State that I could have ever given. Now we're going to do some form of something here in a little while or later on, but nevertheless, I thought, our state has come so far, and I'm so proud. I'm proud of everyone that's been involved, and so many people, put in a lot of licks, and I congratulate them and I thank them. But more than anything, I love West Virginia, and I love West Virginians, and to have goodness for West Virginia and West Virginians is a really special thing to me. And so, in looking forward to that, we had a negative test, and then all of a sudden, by 5 o'clock, things started really turning south, and then I had a pretty significant fever and everything, and so I thought, well, I better get to the house and everything, and maybe check my blood pressure and stuff like that. Well, right as soon as I started doing that, my blood pressure was through the roof, and my heart rate was way up, double what it would normally be, and so with all that being said, next thing, you come back with a positive test, and then it took probably about 4 or 5 hours for me to, end up getting the antibodies, and through those first couple of days, it was really nasty stuff. I mean, there's no point in acting macho about it and all that kind of stuff. It was tough. It was really tough stuff. And I've got to tell you this, and I've got to tell you this as sincerely as I know how to say anything, and I mean this. First, this is surely the very, very best book of all time. But I know from absolutely from God above that this could have been unbelievably serious. And it was plenty serious enough for me. But with all that, I was vaccinated completely and had the booster shot. And with all that, there's no doubt combined, with the antibodies, there's no doubt that God has given us the ability to have medicines to try to save our lives. And with all that, at my age and weight and whatever it may be, I've always been healthy as a horse, but to be perfectly honest, this could have been really, really bad. And so a lot of people now sit back and they say stuff like, well, how do you feel now that you got this? Do you feel differently than you felt before and all that kind of stuff? Well, I would say I feel more committed to the fact that just this is, we want to continue, and I am rock solid with being respectful of people and their wishes and their feelings and everything about whether or not they're going to get vaccinated or not. I think that ought to be their choice wholeheartedly. I don't think we need any mandates on anything like that at all. But in all that, I can only give you just a personal testimony and just to just say to you just this, that these vaccines are safe and they could very well save your life. And me being here talking to you right now may be testimony to just exactly just that. If I hadn't had these vaccines, I think I would have really been in tough shape because this is bad stuff. And if you don't believe that, there's nothing else I can do to convince you, because it was nasty and it was tough for a couple days. It was really tough. And so with all that, again, I thank everyone, and I encourage you to go if you're not vaccinated and get vaccinated. And for God's sakes of living, you've got to get your booster shots. I can't tell you again what it meant to my family, Kathy and I, and just all of us, but especially to me, all the well wishes and everything, because it was it really meant a lot, and the prayers meant even more, and at the end of the day, no way on earth I'll ever forget it. Thank you so much. Let me share with you just this. Senator Grady, who's a fabulous young lady that's one of our great senators here. Her daughter Easton, wrote this and everything, and it's just precious beyond belief. And I'm not going to go through all of it with you and everything, but she writes and everything. She says, I'm her favorite governor because from time to time I make her laugh. I really believe that the good Lord gave us the ability to smile and to laugh, and this journey's tough enough. So Easton, I thank you so much. And Senator Grady, thank you so much for having this wonderful daughter and all the great work you do here and everything. But she goes on to talk, she says, you have an amazing heart. Well, and you're really funny. That all that's really great stuff to me. But, she also ends it up by saying, and be sure and say hi to Baby Dog for me. And then she wrote right below it, I think she said, you're a real West Virginia hero, but she may have meant Baby Dog's a real West Virginia hero. But either way, that's great. And I love her for it. And Easton, I'll keep this forever, young lady. I really will. And Senator Grady, thank you so much. But let me get on with the briefing now, if I could, and just tell you just this, that now in the state of West Virginia, and I've been out, a few days, but in the state of West Virginia now, we've lost 5,535 people. It's going to take me a second to read through all these people. We've lost 143 names that I'll be reading here, but bear with me and absolutely just remember this, that the only way that I really know that we can pay absolute respect to these folks is to recognize them, and for me to ask of you to not let them just become a number. I mean, they're so important, and they've given so much, and their loved ones are hurting. The 5,393rd death in West Virginia is an 85-year-old male from Kanawha County. The 5,394th death is a 65-year-old female from Wayne County. The 5,395th death of 58-year-old male from Grant County. The 5,396th death of 73-year-old male from Mingo County. The 5,397th death of 83-year-old male from Kanawha County. The 5,398th death of 61-year-old male from Berkeley County. The 5,399th death of 86-year-old female from Raleigh County. The 5,400th death of 50-year-old male from Lewis County. The 5,401st death of an 88-year-old female from Jefferson County. The 5,402nd death of a 61-year-old male from Morgan County. The 5,403rd death of a 52-year-old male from Marshall County. The 5,404th death of a 69-year-old female from Brooke County. The 5,405th death of a 39-year-old female from Mingo County. The 5,406th death of a 69-year-old male from Cabell County. The 5,407th death of a 43-year-old female from Ritchie County. The 5,408th death of a 97-year-old male from Harrison County. The 5,409th death of a 58-year-old male from Morgan County. The 5,410th death of a 73-year-old female from Clay County. The 5,411th death of a 65-year-old male from Raleigh County. The 5,412th death of a 74-year-old male from Taylor County. The 5,413th death of a 55-year-old male from Upshur County. The 5,414th death of a 79-year-old male from Morgan County. The 5,415th death of a 77-year-old male from Monongalia County. The 5,416th death of a 72-year-old male from Berkeley County. The 5,417th death of an 86-year-old female from Cabell County. The 5,418th death of a 68-year-old male from Gilmer County. The 5,419th death of an 84-year-old male from Work County. The 5,420th death of a 91-year-old male from Kanawha County. The 5,421st death of a 73-year-old female from Clay County. The 5,422nd death, a 73-year-old female from Summers County. The 5,423rd death, an 81-year-old male from Mercer County. The 5,424th death, an 88-year-old female from Mercer County. The 5,425th death, a 72-year-old male from Wood County. The 5,426th death, an 81-year-old male from Summers County. The 5,427th death, a 60-year-old male from Mercer County. The 5,428th death, an 87-year-old male from Greenbrier County. The 5,429th death, a 32-year-old female from Ohio County. Really sad. The 5,430th death, a 77-year-old female from Mercer County. The 5,431st death, a 47-year-old male from Kanawha County. The 5,432nd death, a 78-year-old male from Monroe County. The 5,433rd death, a 61-year-old female from Mercer County. The 5,434th death, a 69-year-old female from Taylor County. The 5,435th death, a 75-year-old male from Mineral County. The 5,436th death, a 57-year-old male from Cabell County. The 5,437th death, an 86-year-old male from Berkeley County. The 5,438th death, a 69-year-old male from Cabell County. The 5,439th death, a 60-year-old male from Berkeley County. The 5,440th death, a 63-year-old male from Mercer County. The 5,441st death, a 69-year-old female from Hampshire County. The 5,442nd death, a 63-year-old male from Mercer County. The 5,443rd death, a 90-year-old female from Upshur County. The 5,444th death, a 62-year-old female from Mercer County. The 5,445th death, an 89-year-old female from Kanawha County. The 5,446th death, a 61-year-old female from Jefferson County. The 5,447th death, a 63-year-old male from Ohio County. The 5,448th death, a 68-year-old male from Lewis County. The 5,449th death, a 41-year-old male from Berkeley County. The 5,450th death, a 78-year-old female from Kanawha County. The 5,451st death is a 71-year-old male from Kanawha County. The 5,452nd death, a 66-year-old female from Taylor County. The 5,453rd death is an 89-year-old male from Hancock County. The 5,454th death is an 85-year-old male from Pleasants County. The 5,455th death is an 85-year-old male from Mercer County. The 5,456th death is a 68-year-old female from Nicholas County. The 5,457th death is a 93-year-old female from Wood County. The 5,458th death is a 61-year-old female from Upshur County. The 5,459th death is a 43-year-old female from Raleigh County. The 5,460th death is a 46-year-old male from Nicholas County. The 5,461st death is a 73-year-old male from Wood County. The 5,462nd death is a 71-year-old male from Nicholas County. The 5,463rd death is a 58-year-old female from Putnam County. The 5,464th death is a 69-year-old female from Marion County. The 5,465th death is an 83-year-old female from Raleigh County. The 5,466th death is a 77-year-old female from Marion County. The 5,467th death is a 43-year-old female from Raleigh County. The 5,468th death is a 70-year-old male from Wood County. The 5,469th death is a 59-year-old female from Taylor County. The 5,470th death is an 88-year-old female from Summers County. The 5,471st death is a 79-year-old female from Wood County. The 5,472nd death is a 69-year-old female from Raleigh County. The 5,473rd death is a 67-year-old male from Mingo County. The 5,474th death is a 72-year-old male from Marshall County. The 5,475th death is a 74-year-old female from Lewis County. The 5,476th death, the 5,476th death is a 63-year-old male from Raleigh County. The 5,477th death is a 77-year-old male from Mercer County. The 5,478th death is a 71-year-old male from Raleigh County. The 5,479th death is an 86-year-old female from Wyoming County. The 5,480th death is an 84-year-old female from Raleigh County. The 5,481st death is a 51-year-old female from Cabell County. The 5,482nd death is an 85-year-old female from Raleigh County. This one's bad. They're all bad, but this one really bad. The 5,483rd death is a 30-year-old male from Harrison County. The 5,484th death is a 74-year-old male from Lewis County. The 5,485th death is a 58-year-old male from Marshall County. The 5,486th death is a 48-year-old female from Marion County. The 5,487th death is a 66-year-old female from Fayette County. The 5,488th death is a 58-year-old male from Randolph County. The 5,489th death is a 67-year-old male from Monongahela County. The 5,490th death is a 74-year-old female from Tyler County. The 5,491st death is a 62-year-old female from Harrison County. The 5,492nd death is a 74-year-old male from Jackson County. The 5,493rd death is an 86-year-old female from Wyoming County. The 5,494th death is a 70-year-old male from Monongahela County. The 5,495th death is a 62-year-old male from Wood County. The 5,496th death is a 78-year-old male from Harrison County. The 5,497th death is a 58-year-old female from Ohio County. The 5,497th death is a 58-year-old female from Ohio County. The 5,498th death is an 84-year-old male from Wetzel County. The 5,499th death is a 69-year-old female from Raleigh County. The 5,500th death in West Virginia is a 79-year-old male from Clay County. The 5,501st death is an 83-year-old male from Kanawha County. The 5,502nd death, an 73-year-old female from Gilmer County. The 5,503rd death, a 69-year-old male from Mercer County. The 5,504th death, a 66-year-old male from Mineral County. The 5,505th death is a 73-year-old male from Jefferson County. The 5,506th death is an 83-year-old male from Jefferson County. The 5,507th death is a 57-year-old male from Raleigh County. The 5,508th death is a 33-year-old female from Monroe County. The 5,509th death is a 58-year-old female from Mason County. The 5,510th death is a 79-year-old female from Monongalia County. The 5,511th death is a 68-year-old male from Doddridge County. The 5,512th death is a 78-year-old male from Wood County. The 5,513th death, an 86-year-old female from Jefferson County. The 5,514th death, a 63-year-old male from Taylor County. The 5,515th death is an 88-year-old male from Jefferson County. The 5,516th death is an 83-year-old female from Harrison County. The 5,517th death is a 49-year-old female from Berkeley County. The 5,518th death, a 70-year-old male from Raleigh County. The 5,519th death, a 69-year-old female from Harrison County. The 5,520th death, an 82-year-old male from Hardy County. The 5,521st death is a 63-year-old male from Hampshire County. The 5,522nd death, an 80-year-old female from Wyoming County. The 5,523rd death, a 61-year-old female from Hampshire County. The 5,524th death, an 88-year-old female from Jackson County. The 5,525th death, an 80-year-old female from Hardy County. The 5,526th death, an 87-year-old male from Jefferson County. The 5,527th death, an 80-year-old male from Mercer County. The 5,528th death, a 75-year-old female from Cabell County. The 5,529th death, a 67-year-old male from Marshall County. The 5,530th death, a 77-year-old female from Raleigh County. The 5,531st death, an 87-year-old male from Wood County. The 5,532nd death, a 50-year-old male from Pocahontas County. The 5,533rd death is an 87-year-old female from Raleigh County. The 5,534th death, an 81-year-old female from Mingo County. Let me do that one again. The 5,534th death is an 81-year-old female from Mingo County. And the last one today, the 5,535th death in West Virginia is an 86-year-old male from Monongalia County. I know I've been gone a couple of days and everything, and but it's astronomical to think. I think there was 143 folks that we lost here, if I'm correct. Just one second. 143. As far as the numbers go, the numbers are pretty tough. We've got 20,000 active cases now, 20,392 in West Virginia. We have 376, new positive, 3,673 new positive cases in West Virginia today. Our daily positivity rate is at 22.51. Our cumulative rate is at 7.32. Recovered cases, they haven't changed much since I was here last. They're a little over 364,000. You got 854 people that are hospitalized, 200 in the ICU units, and 116 patients are on a ventilator. We have 14 pediatric cases that are now, that are confirmed and hospitalized right now. Overwhelmingly, again, for the number of people that are in the hospital and surely the number of people that we're losing, it is unbelievable the number of people that are unvaccinated. You know, it's right at 90% of those that we've lost, that have died, are unvaccinated. Omicron still continues to run rampant for all practical purposes. All the testing and everything they did with me, they think that that's exactly what I had, Omicron, and so we've told you over and over how contagious it is and everything, and you know all the precautions that I'm sure that you got to know that I take and the people around me take to ensure that their governor's not going to end up with COVID. Well, if I can end up with it, you can end up with it. I'll promise you that. There are 27 outbreaks in our schools in 16 counties. Today's a really special day, though. It's Martin Luther King Day. Now, if you just think about Martin Luther King Jr., it was an amazing life. You know, but not only was it an amazing life, that life carries with us every day, every single day. You know, he helped really define the 20th century, did he not? And we have so much to be thankful to him for. He did have a dream. He did have a dream of peace and kindness and love. You know, I've said it 1,000,000 times over. You know, I look at that English bulldog, and that English bulldog makes us smile, and unquestionably, she loves everybody. Everybody. Is that not exactly what Martin Luther King thought? Is that not exactly what Martin Luther King Jr. would have wanted for all of us? Really and truly. A great, great man. A great man that is really missed and we should absolutely pay tribute to in every way. The folks at the Herbert Henderson Office of Minority Affairs and the Martin Luther King Jr. State Holiday Commission are hosting, services right today or this morning. And so absolutely, we thank them. We thank all those that go together to pay tribute, and we all need to do exactly just that. A great man, a man that changed the absolute world. He did. He changed the world, and we absolutely owe him that thanks. And a life gone way, way too soon. I've been through all the stuff about my experience with COVID. The National Guard is stepping up in all kinds of places and everything, and I have directed our interagency task force and everything to use them in any way we possibly can to help us staff and make sure that our hospitals are functional, and they're already doing phenomenal work. It says my notes here says to date, we have executed requests for 113 hospitals, and we've got we've executed requests for 13 hospitals, and we've got 115 guardsmen and women that are now deployed right now. So, all through every single inch of everything that goes on within our state, whether it be the terrible floods that we've had or, the terrible storms, whatever they may be, whether it be snow, whatever, absolutely this terrible pandemic, we always call on the Guard, and they're always there. So we thank them in every way. Just simple reminders again, if you're 65 and older, right here, this guy right here, and you get any symptom whatsoever, I've told you over and over and over, the first thing you need to do is get a test. And then if you happen to test positive, if you just happen to test positive, as this guy right here did, then what I tell you, then we've got to run to the fire and try to get you the antibodies, do we not? And that's exactly what happened with me. So just remember that. Any symptom, go get a test. Please go get a test. I encourage you, if you're in a crowd of people you don't know indoors, to think really, really hard about wearing that face mask. The FDA, revised their age on the boosters down, I guess we dropped it from 18 down to 12 and older. And so I can't tell you enough about getting your booster shots. You really, really need to get them. We still continue to make a little bit of headway. It's slow, but we're making headway every day. We got 70.3% of those that are 18 and older that have gotten their first shot, 82% 50 and older, and right at 90% of 65 and older that have got their first shot. And that's good stuff. I remind you, absolutely, when your time is right to get the booster shot, get that booster shot. We continue to ask for help from everyone, from our parents to our grandparents, to get our kids across the finish line. All the information is up there about our COVID vaccine line. It's all there right for you. All the free testing stuff is up there, and in every way we continue to thank Frith and Walgreens for all that they've done. We've got 127 outbreaks in our long-term care facilities. That's up 27 since the last time I was with you. We now have 3 outbreaks in our church community, and those are in the counties of Kanawha, Monroe, and Webster counties. We have 180 inmate, cases and 167 staff cases in corrections. I want to remind you to get your flu shots. You can do that at the same time that you're getting the COVID vaccine. I want to remind people again over and over, if you're a renter or a landlord, there's still dollars there waiting on you. If we can get you qualified, and all you got to do is call us and see if we can get you qualified. I want to again ask any and everyone out there to give blood. It's really, really, really important. And I've got well wishes here for a lady in Lewisburg, West Virginia. This beautiful lady was born on January the 6th, 1917. Her name is Pauline. She goes by Polly Welch, and she is 105 years old. So, Polly, I didn't get to wish you, happy birthday, on your birthday, but nevertheless, I know it's belated, but nevertheless, keep it going. Let's get to 106, and then let's shoot for 110 and just keep on going. Polly, happy birthday, and thank you so much. That's all I've got right now. Thank y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon and happy Martin Luther King Jr. Day. Much to celebrate. Much to celebrate today, and certainly we are so grateful that the governor is back to a very outstanding level of recovery from his recent COVID infection. And as he said, it makes it so important and such an illustrative example of why vaccines and boosters, along with some of our new advances in therapies like monoclonal antibodies, are so important. So as we look at COVID-19 in West Virginia, what we see is that we continue to grow in the number of cases, and also we continue to grow in the number of cases of COVID-19 that we can ascribe to the Omicron variant. With our last sequencing run, we found that 82% of our sequenced cases in West Virginia now belong to the Omicron variant. And as we look around the country and look around the world, we see very clear evidence, as the governor said, that these vaccines are so incredibly effective. In the country of Israel, they found that 100% of the people that are currently on the most advanced and most critical life support that we can offer, which is really bedside cardiopulmonary bypass machines, and we call it ECMO, extracorporeal membrane oxygenation, that if 14% of the population of Israel that's unvaccinated, 100% of the people on the ECMO machines are unvaccinated. And we find the same thing for teenagers 12 to 17. Recent study from the New England Journal demonstrated that 98% of children who are in ICUs are unvaccinated. So we know that we have effective therapies that can help prevent the most severe consequences of COVID-19. We also know that despite the loss of potency related to the potential for reinfection after your COVID vaccines and even after your boost, we know that these vaccines still maintain a very effective ability to reduce the most severe consequences of people with COVID-19. The other thing is, we know from what the governor went through and reflected in his opening remarks, that if you do feel like you have an infection, a scratchy throat, congestion, a cough, you should absolutely be tested. And if you are in a high risk group of having more severe consequences with COVID-19, let's say you're older, you have pre-existing, problems that may put you at more risk. And if you are unvaccinated or partially vaccinated, which also puts you at much higher risk of more severe consequences, then getting tested, and if you test positive, immediately connecting with your healthcare provider can be life-saving. And we do have a variety of tools that we can use early, better in the course of your diagnosis to be able to help you avoid the most important consequences, and the most severe consequences like hospitalization, ICU admission, or death of COVID-19. In our country, we just passed 850,000 deaths, which is really quite extraordinary. And we are well on our way to 1 million deaths. We are averaging over 800,000 cases a day for the last week. And remember, prior to the Omicron variant, we had the maximum number of cases reported in a single day being only 303,000. So we know that there is going to be more cases reported. And importantly, at least based on data that we learned in South Africa, that perhaps as many as 40% of people there were relatively asymptomatic and may not have been moved to get a test because of symptoms. And also we know with home testing, we may well be underreporting the true number of new positive cases. So this variant is spreading very rapidly, including in our state. Hospital numbers are higher than they've ever been, including hospitalized children and teenagers. So it is really time for us to take great care and great heed. The most important thing we can do is fully be vaccinated and be boosted for those eligible. And we know that more people still need to be vaccinated, particularly in younger age groups, and more people need to be boosted in all age groups. Thank you very much.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon, Governor. Welcome back. I'm glad to see you back and on the road to recovery. A couple of items to point out today. The governor mentioned earlier, we have 13 hospital requests today to be filled by 115 members of the National Guard. Liaisons are working with those facilities today, and you will see guardsmen deploying in to those facilities starting tomorrow. So we continue to appreciate the great work of the National Guard, their flexibility and capability to respond quickly, as the governor pointed out earlier. One of the things that we in the task force are tasked with doing, based on the governor's intent, is to focus on the stability of our hospitals. As I look at those numbers every day, there were two numbers that struck me this morning when I looked at those. 91% of the people on ventilators are unvaccinated. 84% of the people in ICU are unvaccinated. Goes back to the governor's point that he made earlier. Fortunately, in his case, he had his vaccination and his booster. And as he told you earlier, it made a significant impact on his ability to overcome this terrible virus. So again, reinforce to folks the importance of getting vaccinated. As the governor pointed out, we will not stop. We'll continue to try to educate people and provide them with the appropriate information to understand the value. As Dr. Marsh pointed out, cases are going to continue to expand under Omicron because of its level of contagiousness. I think it's important that we all understand while CDC and others are saying that it may be less severe. I read an article this morning that quoted Jerome Adams, a former Surgeon General, and he likened it to this approach. If an enemy has a weapon that's only 1/3 as deadly or 1/3 as capable, but 4 times as many of the enemy are using that weapon, then you're 1.3 more times likely to die. So again, we've got to pay attention to what's going on around us, continue to press for vaccination, and continue to push through to get back to a level of normalcy in our state and our nation. Thank you.
Great, thank you, sir. Next to Dr. Ainam Jadar, State Health Officer.
Good morning. Glad to see the governor is back and well. And I just want to remind everybody about the mask recommendations. Or CDC has recommended that if you're unvaccinated to wear a high quality mask indoors. High quality mask could be an N95 or KN95, or if you can't find those, a surgical mask, which has 3 layers. We also encourage that if you are vaccinated and fully boosted, to use precautions when in large crowds, and just to think about where you're going and the group that you're around. If there's any more questions, we still have information about the masks on our DHHR dashboard. Thanks.
All right, thank you, Doctor. Secretary Bill Crouch is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Welcome back, Governor. Good afternoon, everyone. I'm getting more and more reports personally from people that I trust that there are more reinfections going on. And I'd like to hear from the medical folks whether Omicron is more likely to reinfect someone that has had maybe Delta or an earlier version. Is there any study or any medical information out there that would justify how many of these seem to be coming up these days? Thank you.
Dr. Marsh, this is you, sir.
Thank you, Paul, and thank you, Governor. Absolutely, Omicron is by far the most infectious form of COVID-19 that we've ever seen. And as an example, remember that Delta, which came from India, when it replaced the Alpha variant, which came from the United Kingdom, it took about 3 to 4 months to see that replacement in the US. Omicron replaced Delta in the US in 3 weeks. So if you look at the R values, and if you do the R naught, which means the reproductive value, the transmission ability with a non-immune audience, the initial variant from Wuhan was about 2.3 to 2.7. The variant from the United Kingdom, the Alpha variant, about 4 to 5. The Delta variant, about 5 to 8. And the Omicron variant, about 12. So ultimately, this is so rapidly infectious that people are getting reinfected who have had previous infection with COVID-19 very consistently. And that immunity to Delta or others, unless it's absolutely recent, probably doesn't give much in the way of immunity at all. We know that vaccines, particularly the 2 doses, start to lose potency when it comes to reinfection after about 4 to 6 months. and the booster loses potency after about 3 to 4 months. And when you look at Omicron, and I'll quote the Pfizer numbers, if you're 6 months after your 2 doses of Pfizer, as far as reinfection rate, your protection is about 0 to 20% with the Pfizer vaccine. And with the booster, acutely, it's probably about 70%. And then it goes down to the low 50% or so. So this is a variant that can certainly reinfect people who have either not been boosted, who have had the longest time since the last dose, or have never been immunized, and who may have recovered from a previous COVID infection. In fact, Paul, this is exactly the reason why the governor tasked us and created the letter to the FDA and the CDC and to President Biden, because we believe that another booster dose would have been very important to give as we were seeing our Omicron cases grow, to try to reduce that person-to-person spread so that we could try to reduce the surge on the hospitals. But at this point, at 82% of our most recent cases, that window of opportunity may well be shutting on us to reduce that reinfection rate. Thank you.
All right, thank you, Paul. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Good afternoon. Hope everybody is safe and sound. Governor, it is good to see you back at the Capitol at your desk. I'm thankful that you have recovered, and continued good health to you. Good work, Dr. Marsh and the rest of the gang. Couple of quick questions. One, the county map has not been working for quite some time on the DHHR website. Can we get an update about what's going on there? A lot of people use that as a quick reference with the colors. It was easy to understand where the serious places were in the state, and that's been missing, and people have been letting me know about it. So I wanted to ask that question. Also, Governor, if you could address the road work that's been going on throughout the morning and day with the updates that you've been getting with the storm that hit West Virginia. I know that this is a COVID briefing, but right now it's snowing here in Charleston. If you look out the windows behind you, probably you'll see it too. And can you give us an update on where we are and if things are going well, and if you're pleased with the response? Also, one last thing, General Hoyer, we are 1.3 watts more likely to die if an enemy hits you at a rapid rate with a less capable weapon. Is it 1.3 times or 1.3%? Thank you very much.
Okay, Kenny, I'm gonna let General Hoyer go back through the math here in just 1 second and everything. But thank you for your kind words, and let me just say this. You know, before I pass to Secretary Crouch, you know, Kenny, I know a lot of people use our color-coded map and everything, and they rely on it and everything, and go to it from time to time. There is now some, and it's just perfect for Washington. You know, it goes back to, you know, how can we possibly confuse people anymore? But you know, this business of going, you know, 5 days a mask, changing the map, changing our color-coded map and everything, you know, to adapt to that and everything. There's all kinds of challenges there. I'm sure Secretary Crouch will go through that with you. From the standpoint of the DOT, all reports that I'm getting so far is the DOT is doing a good job of keeping up. You know, it may not be perfect, but I think they're doing a good job, and you know, so the reports that I'm getting so far is the roads are clear, and they're continuing to stay on top of them. As it continues to snow, and with a little bit of ice and everything that we had and everything, it's more of a challenge. It's always a big challenge, but we're trying to stay on top of that. But Secretary Crouch, I'll go to you, and then I'm going to come back to General Hoyer. And General, you can go through that math one more time, you know, for Kenny and everything. It'd be good.
Yeah, thank you, Governor. Welcome back. Glad you're feeling better. And thank you, Kenny. And the governor's spot on with regard to the map. We're really trying to be careful and methodical here how we move forward with the map. This virus is now 2 years old and has changed significantly from from the way it started. We just listed technical difficulties. Those technical difficulties have to do with the changes CDC made with regard to recovered cases. So the data that we utilized did utilize to make those calculations is no longer all there from that standpoint. So we're looking at the best way to push this out. We're very close to making a decision. I actually thought we might have it today. I suspect that will be here in the next couple of days, that we'll be able to push out to map with some changes that are beneficial to folks, but still maintains kind of what we've done in the past. So we will push that out as quick as we can. Thank you. And not sure who's next there, Jordan.
So Kenny, it was former Surgeon General Jerome Adams that posed the math problem that if an enemy had a weapon that was only 1/3 as effective or 1/3 as capable, but 4 times as many people firing it, then you would have 1.3 more times likelihood of dying. So likening that to the fact that a much greater number of Omicron cases are out there. So while it may be considered in some cases less severe, a much greater chance of somebody being severely or unfortunately deadly impacted by the virus.
All right, thanks, Kenny. Next to Charles Young with West Virginia News.
Hi, this is Charles Young with West Virginia News. I wanted to go back to what Dr. Marsh said about our letter to the federal agencies in Washington. You said we believed this would have helped and that our window of opportunity is closing. So I was wondering if we ever heard a response back one way or the other about that letter, but either way, it sounds like that's not a strategy we're still pursuing. Thank you.
Dr. Marsh, please.
Thank you, Charles. Thank you, Governor. So, Charles, we know that the most important role of vaccinations and boosters is to give people the maximal amount of immune protection as they may become exposed or infected with the virus. So we would still be interested, certainly, in being the first place in the country to be able to roll out an additional booster, given the severe complications we have in our population related to chronic medical disease, the 3rd oldest state in the country, as we had talked about previously, as evaluated by Kaiser Family Foundation. But one of the important opportunities we felt coming up into this time was because of our concern of the hospitals being challenged with a surge at a time that staffing is also low and people who work in hospitals are susceptible to being infected by the Omicron variant of COVID-19, is we thought this could be an additional strategy, the next booster, to try to reduce that height of the surge, flatten the wave like we did in the beginning of the pandemic. And although we still would believe that there is an opportunity to do that if we offered another booster shot, we know that as Omicron becomes the prevalent variant, then that benefit starts to reduce. We were behind the rest of the country and we saw a lesser amount Omicron. Like 2 weeks ago, we were about 15%. Last week, we were about 45, 50%. And this week, we're 82%. So as we see Omicron basically gain that share, which we anticipated would happen, then the potency of the vaccine related to protection from infection or infection from Omicron is not as good as that protection against Delta. So while we would still, certainly favor that opportunity, it probably will have a little bit less impact on flattening the curve as opposed to if we'd had that opportunity a few weeks ago.
All right, thanks, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members and fellow reporters. Governor, I'm going to ask kind of a personal question, and if it's too personal, feel free, respectfully not to answer it. But it's kind of shaping an overarching question I have. I'm wondering if at your worst moments in this, you thought to yourself, I may not make it, or I'm not going to make it. And sometimes our mind takes us to dark places when we're faced with serious illness. And the reason I ask that is, how may have this profound experience change the way you deliver your message about COVID going forward? I ask that in particular because every time you read somebody who died in their 20s or 30s, you choke up and you have a very difficult time, as I think anyone would, talking about the death of a 20 or 30-year-old to this disease. So I'm wondering if this is going to change your message going forward or make it more profound. And one of the other reasons I asked it is there's a demarcation here. People under the age of 40 aren't getting vaccinated. People over 40, you've been very successful. But I looked at the numbers today, and the younger people get, the more abysmal the vaccination numbers are. And so I'm wondering if your experience and your message going forward may have an effect on that. Thank you.
Well, Mark, you know, I don't try to dodge anything, and I just always will just tell you the truth. But I don't, you know, I am such a optimist, I guess is the right word, but at the same time, I want to be conservative in my views of what I say, but or the way I think. From the standpoint of really thinking that you're going to die, you know, I don't know that I progressed to that level. From the standpoint of being afraid as to what was going on and everything, or alarmed, you know, without question, I was surely there. From the standpoint of having confidence in the vaccines and stuff, I had that confidence, and I had the confidence in all of the medical team all around me and the great doctors all across this whole state. You know, from the standpoint of thinking about all these people, and really, I guess the most profound thing that I had was just simply just this. How many people have I read their age and gender and location or county? How many of those people really thought, man, you know, this is my day, I'm not going to make it today, and this is the end for me? Or how many really thought that they would ever really get this? And probably not very many. It's almost like, you know, how many people think today they're going to go out on the highways and it's going to be the day they get killed on a highway in an automobile accident? But nevertheless, you know, Mark, I'll promise you that this is something that no one wants to get, because it grabs a hold of you like you can't imagine. I mean, you think you're strong and you're semi-invincible and everything, but it grabs a hold of you, and it lets you know that it's really tough stuff. And so Mark, I really just believe with all in me that I've been either blessed or fortunate in regard to the messaging to be able to tell people all along that they needed to get vaccinated. This is nothing to play around with, and absolutely you need to get your booster shot. You know, it's just more profound now. I mean, that's all there is to it. It's just that simple, you know. And we do need to get vaccinated. We do need to get our booster shots. We do need to be respectful of others, and I know that may be hard for some people to understand. And if it is, it's just tough stuff. I believe with all in me, we need to respect the freedoms in this country, and but at the same time, I believe with all in me that I need to try to continue to urge people to try to some way get more and more and more people across the finish line. Now, Mark, the last thing I would say is just this. In reading those names, it's awful. It's awful beyond belief. Not nearly as bad as the people that have lost those loved ones by no stretch of the imagination, but it's awful. And when every time that I see one pop up that's you know, younger person, the first thing that comes through my mind is, gosh, you know, I think about my kids and I think about their age and I think about, you know, just, and then, you know, I guess from now on, I'll even more so think that, how was I lucky enough? How was I absolutely lucky enough to not be one of those that's gone, you know, and because it was nasty stuff. So I really believe, first and foremost, you know, I've been blessed by God above. And I've been honored by the great people of West Virginia to be your governor. I'm going to continue to tell you the truth. I'm going to continue to tell people to get vaccinated and get boosted. And I thank all the medical team and all those people that are around me. And more than anything, I thank all those that offered up their prayers. So, Mark, I know I've rambled on here, but you asked the question. I'm going to try to tell you the truth as best I can.
All right, thank you, Mark. Next to Evan Bevins with Ogden Newspapers.
Thank you. Wanted to see, we talked about the percentage of cases that have been determined to be Omicron. How is that determined, which ones get the genetic sequencing, and how well do you think that reflects the prevalence of that particular variant in the state? Thank you.
Dr. Marsh, this is you, sir.
Well, thank you, Governor, and thank you, Evan. From the sequencing standpoint, we end up sequencing around 10% of the positive cases around the state. And we try to choose them from geographic distributions and also try to sample areas that are having more active case numbers. Now, with the current surge, we're seeing that more distributed, but we try to sample from more urban parts of West Virginia, larger cities, larger counties, and also smaller, more rural parts of West Virginia. And I think that the important issue may not be just it's this number, it's really that trend. And remember, about 3 weeks ago, 4 weeks ago, we saw 2 cases, then we saw about 3%, and then we're up to about 15%, and then we were at 50%, and this last week we're at 82%. So we can see that growth, the longitudinal view. And I think it gives us that insight, as we knew would happen in West Virginia based on watching other states ahead of us, more urban places, other countries. Omicron very rapidly replaces Delta as the variant that is most common in everywhere it's been. So we pretty much knew that would happen here too, and is currently happening. So as we watch this, we are trying to understand both at the global level, but also at the county level, which counties may have more activity with Omicron and which may have some more residual with Delta. Because while the symptoms of the two can be a bit different, we know that the treatments for both are also different, and trying to utilize all of the monoclonal antibodies we have. So if we can detect areas where Delta is still active and people have symptoms of Delta, loss of smell, loss of taste, really more shortness of breath, more low oxygen, then we may be able to utilize other treatments like the antibodies for Delta, where other states that have seen Omicron account for virtually 100% of their cases may not be able to use this. So we're trying to use this to maximize our ability to use every tool at our disposal. But this, to me, is important to see that transition in the longitudinal numbers, which we anticipated would happen, and we believe is happening right now.
All right, thank you, Evan. Governor, I'll turn it back to you.
Well, first of all, thanks, you know, all the kind words that everybody had today, and especially thanks to all those that were kind enough again to send up their prayers and you know, their well wishes. I love this right here from Easton, and you know, and I paused just a second. You know, she spells her name E-A-S-T-Y-N, and it's a beautiful, beautiful name. But nevertheless, thanks, Easton. Thanks, Senator Grady, and thanks to all the media and everything, and all the kind words that you had today. I want to go back just 1 second. You know, Kenny, you asked because I was trying to follow too. You know, about our general. You know, trying to equate. You know, I guess what a Surgeon General had said, previous Surgeon General had said, and in regard to the enemy, basically that I mean, if maybe I could put it in a little easier terms that maybe this enemy is not as strong as a Delta type enemy. Maybe this enemy is only a third as strong or a third as big or a third as lethal. But all of a sudden there's 4 of them out there instead of 1. And all 4 of them are shooting at you. You know, the general put this in a military term. Well, if all 4 of them are shooting at you, you've got a higher likelihood of maybe not making it than a strong person shooting at you, a strong enemy. So, without any question, this Omicron is all around all of us, and we really need to be really careful. That's all there is to it. We're going to have to live with it, are we not? We don't want to crawl in a hole, and I'm surely not going to do that. But with all that, we need to try to be prudent and be careful if we possibly can. Again, you know, I read through today 143, and I know it's been a few days since I've been here, but 143 great people we lost. And it is hard. It's hard to do. You know, it's especially hard to do knowing, you know, just how tough you felt just a few days ago and how this came out of nowhere. You know, there's a lot of great stuff going on in this state, but the treasure in this state always is its people. And I mean it when I tell you I love you with all my soul. I'm proud to be your governor, and I thank you, West Virginians. You're the best of the best of the best. So thank you so much.